Good morning. Myself, Sehba Afreen from NZSI Group, second year, is going to present the seminar on the topic of diet survey. Diet survey means what people eat and how much they eat, what are their likes and dislikes, and dietary beliefs as also dietary practices. A nutritional survey is never complete without a diet survey. It is nothing but the scientific assessment of food consumption and using this data for various purposes, including assessment of nutritional status. Dietary assessment is an evaluation of food and nutrient intake and dietary pattern of an individual or individual in the household or population group over time. It is one of the four approaches in nutritional assessment to evaluating the nutritional status of individuals comprehensive. The other three are anthropometric, biochemical parameters, and clinical examination. Why diet surveys? Dietary surveys help us to determine which population subgroups, as defined by age, sex, race, ethnicity, income, urbanization, or education, are at risk for energy and nutrient deficiencies. It also helps us to know the special preference for a food and foods avoided or disliked and alternate food consumed during the special conditions like drought and in tribal areas. The main purpose is to improve the diet of people at household level, particularly to improve diets or feeding of young children, pregnant and lactating women, and even for planning of national food strategies, especially in food crisis and even in a research purpose to assess the effect of nutrition education program. Periodic dietary surveys done at time intervals provide information on trends of food consumptions. Dietary assessment can be qualitative, types of food consumed, opinion and attitude towards food and cultural significance of any food, or it may be quantitative, which is exact amounts of food consumed in terms of grams or liters and their nutrient content assessed. Selection of an appropriate method for dietary assessment depends on the purpose of the study, which may be to measure food consumption, nutrient intake, or eating habits. Nutritional assessment intake of human is assessed by five different methods. These are 24 hours dietary intake, food frequency questionnaire, dietary history, observe food consumption, food diary technique. 24 dietary intake. It is one of the easiest and most popular methods for conducting a dietary surveys. Studies have revealed that if properly conducted, the 24-hour recall method reveals reliable information regarding the food intake, amount, and quality. The interviewer asks the homemaker to recall all the food consumed by the family in the past 24 hours. Assuming that the interview is done during late morning hours, example 11 a.m. to 12 p.m., the individual is asked to think back in time and recall what was cooked and consumed for the breakfast on the day of interview, for the dinner last night, and the lunch on the previous day. In short, it means inquiring about all the food consumed after the previous morning's breakfast. It is suggested that The recall should begin from the most recent meal and proceed backward in time. In the first step, the individual is asked to recall the items consumed during the last 24 hours. After this, the amount that was consumed is probed. This has to take into account the leftover portion which is to be deducted from the total amount cooked. In the third step, the amount of each raw ingredient that went into cooking of the items is asked. Food models to demonstrate this measuring instrument can be used and to guess the portion sizes more accurately. Also, she or he can be asked to demonstrate the spoons and cups which were used to measure the particular ingredient. The interviewer can assess the volume by filling it with water and pouring the same in a measuring cup. It is good idea to carry measuring spoon set and other measuring instruments such as measuring cups and cylinders. Also examines the packages of the pre-packaged food items consumed. It is a quick, easy, and depends on short term memory but may not be truly representative of the person's usual intake. Second method, food frequency questionnaire. A food frequency questionnaire method is based on the principle as to how frequently an item is consumed over a period of time. Frequency questionnaire review of intake frequency, that is, food consumed per day, week, per 15 days, or per month. It consists of a finite list of foods and beverages with response categories to indicate usual frequency of consumption over the time period required. To assess the total diet, the number of foods and beverages required typically ranges from 80 to 120. Usual portion size can be asked separately for each food and beverage. Alternatively, portion size can be combined with frequency information by asking respondents to translate usual consumption amount to number of specified units. Example, how often do you eat a half cup of rice? Some questionnaires include portion size images in an attempt to enhance reporting accuracy. And the third method is dietary history. A dietary history is any dietary assessment that asks the respondent to report about past diet. The diet history is a traditional method of analysis of food intake. In its traditional structure consists of three components that provide an overall information of the usual food consumption pattern of the individual and also detailed information on certain foods. The information is collected in an interview and requires highly experienced qualified interviewers. The quality of information depends largely on the skills of the interviewer. It is mostly used in clinical practice. It also been used in studies of diet and health relationship to investigate the usual diet in the past. The high cost and long duration of the interview limit their usefulness in large epidemiological studies. The fourth method, observe food consumption. Direct observation of dietary intake is often undertaken as a means of validating a dietary assessment method by providing an objective measure of dietary intake. Eating behaviors, including items and amounts of food consumed and received or given away or spilled, can all be noted. However, it is not a feasible method for obtaining habitual diet data at either a group or an individual level. Here, observation provides an objective assessment of dietary intake. It minimizes errors associated with recall and social desirability biases. It provides accurate information on the social and physical context of dietary intake, and it's also useful for population unable to record their own intakes. And the fifth method is food diary. It is a real time record of what is actually eaten, usually over a period of several days. There are many mobile phone apps which can automate the process of recording and analyzing the food and beverages consumed, making the food diary method currently the most popular method for dietary analysis. To complete a food diary, you record all the food and beverages consumed over a set time period, commonly 3 consecutive days, 2 weekends, and 1 weekend day is used, sometimes just 1 day. The consumed items can be measured using a scale or other household items such as measuring cups or spoons, or estimated using a portion size guide for an instruction completing a food diary. Using a food diary provides a measurement of food types and quantity and does not rely on memory to recall what has been consumed, such as with the food frequency questionnaire and the 24-hour recall. Having the subject be responsible for recording their diet may also result in positive behavior change. Focus group discussion. It's an instrument designed to gather information primarily about beliefs, values, and understanding. Here, the participants are specifically selected to explore the range of these beliefs in a food study population. Here, dynamic facilitates the collection of relatively detailed information on prevalent attitudes and ideas, conflicts, and contradictions. Food balance sheet is a comprehensive compilation of a selected country's food during specific time period. The food balance sheet shows the food items for human consumptions, along with how it is produced, used, imported, or exported, and how it benefits the society per capita supply. Food balance sheets provide essential information on a country's food system through 3 components: domestic food supply of the food commodities in terms of production, imports, and stock changes. The food balance sheet is invaluable to determine national dietary recommendations. Food balance sheet provides the data on the national average of food supplies. In the absence of data from household surveys, food balance sheet data provide a good proxy for food consumption levels of the population as a whole. Thank you.